When it comes to anesthesia in patients with liver diseases like cirrhosis, although there are so many points to know, as far as the exams are concerned, we need to know at least these 5 points: ascites, coagulopathy, encephalopathy, to avoid halothane, and atracurium being the muscle relaxant of choice. Now, coming to ascites, a tense ascites may decrease FRC, adversely affect pulmonary gas exchange, increase risk of aspiration. Pleural effusion may also produce atelectasis. There may be intra and extra pulmonary shunting, increased central venous oxygen saturation, and altered lactate metabolism. And due to massive fluid shift, there may be profound hypotension on induction. For the same reason, use of sodium-free fluid such as albumin is advocated. Coming to coagulopathy, all coagulation factors except factor VIII are markedly reduced in liver diseases. CLD patients have thrombocytopenia due to splenomegaly and decreased thrombopoietin. So there is increased risk of bleeding as well as increased risk of thrombosis. And we would like to do nasogastric tube insertion carefully because of the risk of esophageal variceal bleed. And we may have to avoid some forms of regional anesthesia, maybe the epidurals, depending on the coagulation profile. We may also like to avoid intramuscular injections, and we may also want to keep the blood components like FFP, platelets, and cryoprecipitates ready. Now, coming to the third point, that is encephalopathy. Cirrhotic patients have increased risk of encephalopathy, so we would like to avoid long-acting opioid, or we may altogether avoid preoperative sedation. Now, coming to the fourth point, that is avoidance of halothane. Halothane causes halothane hepatitis, and halothane also decreases hepatic blood flow. So, if we are going to use inhalational anesthetics, sevoflurane or isoflurane is the better choice. And atracurium, being metabolized by Hoffman degradation, is a preferred muscle relaxant in case of liver diseases. Apart from these 5 points, hypokalemia due to diuretic use, poor nutritional status, increased risk of infection, thereby the need for good antibiotic coverage, risk of delayed drug clearance and prolonged half-life, and propofol being the preferred induction agent as it avoids phase 2 metabolism, should be kept in mind.
To see you cry, I never listen to your tears.